Together with me is Professor Ricardo Terra. He's a scientific director of the Brazilian Society of Thoracic Surgeons. And you are here as a representative also from the society, and also you have presented many things and many innovations, and I would like you to tell us a few words about everything about your presence here.
Sure, thanks. I came as a scientific director of the society, as a representative of my society and also of my university. From my university, I presented an abstract in which we evaluated the costs of robotic surgery in comparison to VATS. We demonstrated that the costs are similar. I also presented a lecture on how to teach residents performing robotic lobectomy. And this is a new thing because we used to teach them how to perform open surgery, and then we migrated to VATS surgery, and now we are concerned about how we would teach them robotic lobectomy. And so that was a very interesting topic, and I think it went very well. And I'm also, not myself, but people from my group are presenting results of studies we did with our database. So our database is now growing fast. It is an initiative that was supported at the beginning heavily by ESTS. ESTS gave us a lot of support, not only technical support, but also mentoring and so on. This was very important for our society. And now we are collecting the fruits from that. And two of our surgeons presented abstracts, and we were very happy because the two of them won prizes, Maria Teresa and Mariana, both young thoracic surgeons from Brazil. In one of them, we were evaluating how guidelines for mediastinal staging are being followed in Brazil, and the second one was a comparative study on lobectomy on the outcomes of lobectomy for benign and malignant diseases. This is something very common in Brazil, benign diseases, and it's a sort of patient very underrepresented in most of the international studies.
Mm-hmm. And I know that as a society, you're a very active society, and you already had one of your conferences. And what were the topics that you have presented also there, and what can we expect from your society in the future?
Well, our society is now growing very fast in terms of number of members and also in the scientific quality, which is very good. And the database has been helping a lot. In our meeting, it was 3 weeks ago, there was a session together with STS and ESTS, and so Dr. Varela and Dr. Falcos were there, and they presented many things, and Falcos also presented the results of the ESTS database. In a database session, I presented the results of the Brazilian database. Dr. Cameron Wright from STS presented the American counterpart from the results from their database. So it was very interesting. And the idea now is that we increase this collaboration with international societies, particularly ESTS. We have already exchanged residents. We created a training program for young residents who want to, and we'll teach them video-assisted surgery. And during this course, the resident with the best performance is awarded a prize, and this prize includes 3 months in one institution in Europe. Mm-hmm. This was done in collaboration with ESTS. We have already 2 residents awarded. The first one visited Dr. Ruffini our next president.
Yes.
And he was extremely happy with the time he spent in Torino. And the next one, we'll visit Dr. Massard in Strasbourg, probably in 2 or 3 months. And we want to have more collaborative activities with ESTS, particularly in the research area. So we are planning to have more collaboration in the database, not only with the mentoring, particularly Dr. Falcos gave us, but also having more studies done in collaboration.
Okay. So, they're very interesting, all of these that you told us, and we hope we see you soon in one of the next meetings of the European Society, or even your own meetings. Thank you very much for this interview.
Thank you so much.
To meet you.
Definitely. Thank you.
Thank you.